let's first talk about the flu season itself. We're in the midst of it now. It hasn't been that bad the last couple of years because of COVID and people taking precautions, but how worried are you now? And from what you've heard, how worried is everybody that this could be a devastating flu season?
Well, I think that there's good reason to believe, as you alluded to, there are some lower numbers in the past couple of years, and I think that is largely attributable to people wearing masks, to some of the social distancing precautions we've all been taking. But there's been some normalization in that regard, and I think a lot of us are more used to going out, not seeing masks, and I'm keeping my fingers crossed, but I think things are getting a little better. And I do think it's very reasonable to consider that there will be sort of a rebound back to some of the flu numbers that we've seen in the past. We've been fortunate in that those have been very low lately, but it's been something that we've dealt with for a long time, seasonally here in this part of the country and in this hemisphere. And I think we'll see a bit of a rebound from that.
Who's most affected by this? Who does it affect the most, I guess, in a dangerous way?
Sure, absolutely. So statistically, patients 65 years of old age and older are the ones that we're most worried about. Arkansas has every year dozens, sometimes hundreds of flu deaths, and the vast majority of those year to year, regardless of the strain that tends to hit us, tends to be our older patients, especially those that tend to have comorbidities, diabetes, COPD, dealing with active cancer of some kind. So by far and away, those are the ones that we're most concerned about. But I guess that leads us into the other recommendations, which is that so many of our patients who are 65 years of age and older are our grandparents, our teachers, our friends. They see people, neighbors, it's Halloween, trick or treating's coming up, that they will be in contact with younger people who are more exposed to the flu. And even though they have less virulent cases of it, they tend to be better at spreading it. They're at school. A lot of times, schools are in smaller classrooms are a big chance for people to exchange a sneeze here or there. And then on the weekend, everyone goes home, grandparents come to visit. And that tends to be how we get something disseminated out into the more high risk populations.
So that leads into pretty well into everybody ought to get a flu shot.
Absolutely, and I recommend it to everyone 6 months of age or older. I have a lot of patients that ask me about it, but I will tell you from a medical standpoint and from a lot of the research that's been done for flu vaccines over the last decades, several decades, the flu shot remains very, very safe for almost everyone. And that includes people that have comorbidities, people that have immunocompromised states, pregnant women, breastfeeding women. And again, there's concern sometimes that I hear from patients, well, I have an egg allergy, or I have some kind of problems with that. Unless you have an extremely severe allergy to eggs, which means that basically your throat closed up and you couldn't breathe, anaphylaxis is what we call it, you should be okay getting the standard flu shot. And nowadays, because of increases in technology, there are a small portion of flu shots which are set aside for people that do have those severe egg allergies. They're what's called cell growth immunizations, and they have never been incubated in chicken egg cells or anything like that. So there's no reason to believe there should be any problem. The only group of people that we counsel probably not to get a flu vaccine is someone who in the past has had a very strong immediate reaction to getting the flu vaccine. Even then, when you talk to your provider and talk to the health department, there probably are other options that work slightly differently and would do a great job in protecting you or preventing the most severe outcomes of flu this season.
The flu shot and the nasal spray, are they the same thing, or is there any difference in those vaccines?
I would say probably the only difference is availability. And certainly my children, they're always asking, Dad, can I get the flu mist or whatever we're calling it this year? It is very effective. There are certain groups of people that we don't recommend it for. It tends to be people that have more things like asthma or reactive airway disease, tolerate it less poorly. And frankly, it's just not something that you're going to find at every single, rural primary care provider's office. Um, Overall, the efficacy is comparable and it shouldn't be avoided one way or the other. I would say get what you can. As I always tell my kids, no one likes to get a shot, but it's a small pinch and it's a small price to pay for having the worst case of the flu.
And some people I've heard don't get flu shots because it'll just give me the symptoms a day or two later. Is that still the case, or was that ever anything?
And I tell a lot of folks with a lot of vaccines, the way it works is that a small amount of either what's called an attenuated, which means a very weakened form of the virus, which is not contagious or virulent, or a dead version of the virus is introduced to your immune system. And we want it to provoke some sort of immune response. So a lot of people, and I certainly didn't until I studied this, but they don't appreciate that part of the reason we feel bad sometimes when we're sick is because our immune system is doing everything it can to make our body as inhospitable as possible to a bacteria or a virus that's currently taking up residence. So yes, certain things like fever, sometimes some muscle aches, some chills, headache, fatigue can be expected in small amounts the day or so after you get a flu vaccine. But in a way, that's kind of telling you that it works. Now, not everyone has that. And there's indication that the older you are, the less likely you are to have a stronger sort of immune response in the first day or so after vaccination. But it's important to know that is not the flu, that is not contagious. Um, but for the vast majority of people, taking a Tylenol or an ibuprofen and just drinking a little bit more the day after you have a flu shot is perfectly fine, and it'll blunt the worst of the symptoms.
We started this with beginning the conversation with coming out of COVID, coming out of the pandemic. Is it difficult to tell the difference between COVID symptoms and flu symptoms, and how can you do that?
Oh, that's a good question. And frankly, I will tell you, it is difficult. Um, at this point in time, there are rapid flu tests and rapid COVID tests that are widely available. In my office, and this is I warrant to say the average probably across Sebastian County and then the area in western Arkansas and eastern Oklahoma. Almost all providers could do a quick nasal swab, probably do one nostril at each time, and within 10 minutes be able to tell you, do you have COVID? Do you have the flu? Um, Now, for the vast majority of patients, it's the symptoms are going to be the same. The length of symptoms are going to be the same, and probably the risk factors are going to be the same. And I would tell you to do probably the same thing, which is to stay at home, get some rest. If you have certain underlying medical conditions and we've caught your symptoms early enough, we can prescribe you a small amount of an antiviral medicine that tends to shorten the length of symptoms and prevent this sort of secondary release of bacteria, or excuse me, a virus that tends to happen with these types of diseases. But you're right, it can be very difficult. And the fact of the matter is, I have many patients that tell me, doctor, I've never had the flu. That may be, I can't say, but I will say a lot of us have had the flu, and it's not what you see in the flu commercials on TV. You're not shaking at home, sneezing, into a Kleenex, just feeling awful. It's a mild runny nose and a headache. It may very well feel like severe allergies. So yes, there's a whole spectrum of manifestations of it, and it's not always predictable who will have the worst of it. We do know statistically that people over the age of 65 are more likely to have severe consequences and be hospitalized.
So the message now is don't wait to get that flu shot, but talk to your provider about it first too.
Absolutely, always. I recommend talking to a healthcare provider that you trust and just asking them, is it right for me? But middle of October is prime time to get your flu vaccine to cover you through the early spring when we tend to see it here in the Northern Hemisphere. The Arkansas Department of Health has already started releasing, this was the first week they released their weekly flu surveillance report for the state of Arkansas. Sebastian County, where I practice, and then sort of the rest of Western Arkansas, and I imagine your viewership area, is still not in a high risk area. We haven't seen abnormal flux in children out of school. We only have about 200 confirmed diagnoses of the flu this year in the state of Arkansas. I certainly expect that to go up as the season progresses. And frankly, that's the tip of the iceberg. A lot of patients will never get tested, and the statistics won't be reported to the health department. But flu season is here, and every year in the United States, tens of thousands of people die from flu-related complications. Hundreds of thousands of people end up in the hospital, and if you've ever had the flu, you really want to avoid it. So now would be a great time to talk to your healthcare provider about getting a vaccine.
All right, doctor, thank you so much. Appreciate you being here.
My pleasure, Daren. Thanks for having me.